Hi, my name's Nick. I'm going to be your nurse today, and I'm going to do an abdominal assessment. Can you tell me your name?
My name's Emily.
And is it okay for me to videotape you doing this assessment?
Yes.
Okay. First, I'm just going to ask you a couple questions. Have you had any change in appetite?
Nope.
Any nausea, vomiting?
No.
No. Any tenderness or pain?
No.
And any history of GI problems?
None.
Okay, then I'm going to go ahead and start with an inspection assessment. If you can go ahead and lay back. Try to lay flat for me. And I'm just going to get down to eye level here so I can see your belly. And your abdomen appears to be flat, which is normal, so that's good. Next, I'm just going to identify some organs in your abdominal cavity here. So we have your right upper quadrant here. We have your liver, and also in that quadrant there is your gallbladder. Jumping to the other side here, we have your stomach, and same quadrant there behind a little bit, we got your spleen. And then we have your colon here that we're going to look at. On this side we have your ascending colon and the transverse colon going across from right to left, and the descending colon on that left side there. Alright, next I'd like to listen to some bowel sounds. I'm going to start in your right lower quadrant, just work my way around. Just breathe normal for me. Alright, very good. You seem to have normal active bowel sounds, which is good. Not too hyper, not too slow. Next, I'm going to listen to some of your cardiac vessels that go down into the abdominal cavity. So we'll start with the aortic. So we're going to look for where your ribs meet here, above your umbilicus. Sometimes you can even feel it, but we're going to be listening for it. I'm going to use the bell of the stethoscope here. Good. And then over from there, we will do your bilateral renal arteries. Down below your umbilicus here, we're looking for those iliac arteries. And I was able to hear sounds in all arteries, so that's good. Next, we're just going to do some percussion in your abdominal cavity here. Once again, going to start with this right lower quadrant. And that all sounds normal, so that's good. We're going to do some light palpation. I won't go too hard, so we're just going a couple centimeters deep here. Let me know if anything hurts at any time, okay?
Mm-hmm.
I don't feel any lumps or masses. Okay, then next we're going to go ahead and assess for CBA tenderness. So if you could sit up for me. And I'm just going to have you turn this way so our viewers here can see as well. And I'll pull the back of your shirt up. And if at any time you start to feel pain, just tell me to stop, okay? Any pain or tenderness there?
None.
No? Okay, that's good. And lastly, I want to identify your liver borders using some percussion. So I'm just going to have you lay back down for me. Alright, we're looking at the right midclavicular line here, coming down below the ribs. And we're going to percuss, looking to go from resonance to dullness. That sounds pretty dull right there. So we're going to do the same thing from the bottom, looking for tympany to dullness. And that sounds dull about right there. We've just identified your liver borders there. Alright, well, that is going to be all for our abdominal assessment today. Everything appeared to be normal, though that won't be the case in all patients. And thank you very much for participating with me today.
Thank you.